For more on this, let's bring in Dr. Eileen de Villa, Medical Officer of Health for the City of Toronto. Thank you very much for joining us today. And pretty important that this is being done collectively, I guess, because there's been calls for mandatory masks for a long time. Tell me a little bit about why the importance of doing this now.
Well, I think there are a number of things that we need to look at. One is that the science on this issue of mask use is still very much evolving. What we do know is very definitive in terms of the science is that physical distancing, staying home when you're sick, and washing your hands continue to be really important public health measures. But as we've learned over the pandemic, because this is a new virus and there's still lots of learning that's going on, we know that there are people that are able to pass on infection, COVID-19 infection, even when they don't know, like they don't know that they've got virus. They don't even know that they're sick. And we know that cloth masks actually are helpful in terms of blocking the spread of germs from one person to the next. It's not as good for protection per se, but it is pretty good at blocking transmission of germs. So if you put all of this together and combine that with reopening and the risk of people mixing with each other more and therefore creating opportunities where they might have close interaction, now is the time to do this. We want to do it as a preventive measure, and it's really meant to enhance all the other measures that we've got out there, that physical distancing, that hand washing, that staying home when you're sick.
So Toronto could have done this on its own. I mean, it's a region by region basis, but why was it important to get Brampton and Peel all involved in this?
Well, I think that we know that here in the Greater Toronto and Hamilton area, the GTHA as it's known, there's a lot of movement back and forth between our different communities. People don't really stick in one particular neighborhood or specific place. So I think it's important that we have some degree of consistency, and it makes it easier for people to follow the best advice that we can put out there in terms of public health. It allows our businesses to be successful in terms of reopening, and it allows us to get our respective jurisdictions or cities back as sooner rather than later. So I think there is a
And we've
real
heard from
benefit to having that consistency.
Yeah, and we've heard from the Premier that he's obviously not interested in doing a province-wide mandatory mask policy. But I'm wondering, would it help in terms of how effective this measure would be if it was province-wide, for the very same reasons as to why it would be effective to get so many localities involved at once?
Well, I think the idea here is what works in terms of actually getting people to take on the public health measures. And my sense is that what we're trying to do is to build upon those existing measures that we know work. So we're talking about physical distancing. We're talking about hand hygiene, and we're talking about staying home when you're sick. When we add on, the notion of masking policies, it just bolsters all those public health measures. And the more we can create a mask wearing culture, which I know is unusual for most of us, the better chance we have across the province of successfully combating COVID-19 and doing what we need to do to get our respective cities back. I think the other really important part here to think about is that we note, and there is an increasing literature on this as well, that when you see people wearing masks and have more people wearing masks or face coverings, it does remind us that, in fact, we are still very much in the middle of a pandemic, and that it may actually prompt us to remember all those other public health measures like physical distancing and hand washing, just as some examples. So I do think that there is some advantage to having clarity across the province, but to the extent that we get more and more people into this habit, we know that it'll strengthen efforts across the province.
And Dr. de Villa, I just want to ask you about this because there was even a question today about what happens when kids go back to school, and should kids also have to, be wearing these masks? And there's some under two that we've heard, because that may not be effective and obviously could be problematic, and certain medical conditions. But would schools be even more problematic because we're dealing with a different set of age groups?
Yeah, so I think there are some unique considerations that need to be thought through right now. Right, we're not contemplating schools within the context of this bylaw, but I know that there's a lot of conversation that's happening right now around how do we make schools as safe as they can be, given that we're trying to live with COVID-19 in our community. And I think that's what all these efforts are about. How do we actually coexist as safely as possible with COVID-19 in our midst? What can we do together as individuals, as communities, to be as successful as we can be, to have the very many aspects of our lives back in our control as much as possible, whether that's having access to services, being able to have in-person education, or whatever the service or activity we're looking at is. We want to be able to try to restore as much of our regular activity as possible, but learn how to do so safely until such time as we have a COVID-19 treatment or, even better, a vaccine.
A vaccine, yeah, of course. Dr. Eileen de Villa, Medical Officer of Health for Toronto. Appreciate you giving us your time this afternoon.
Thank you.